Wow, tremendous comments from David Nabarro. Let's follow up with George Gao, who actually led the Chinese Ebola response, mostly in Sierra Leone. George, China CDC has some useful experience dealing with acute infectious diseases, some of which could probably be adopted for other parts of the world. What would you suggest as like the top priority investments for infection control in developing countries?
Good afternoon, everybody, and thanks to Norm to invite me to be here. When you are talking something about this, because we are in a session discussing about the incentives. So for what we have obtained and what we have done and what the experience we have from China, it's very important that we have to go back to think about what happened 10 years ago with SARS. So I sort of say, that's incentives. We learned a lesson from the SARS. So I think, without the SARS, we might not be in the position, we are talking about today. From that sense, what I shared some of, the opinions from David. So what, he said something about, you need to get the local government to be really, to lead the whole thing. So what happened, you asked me for the priority. I would say, for the priority, the first list must be the leadership. So obviously we need the leadership, but in China, so whenever we have an emergency, God, you mentioned about something about even with the earthquake, whatsoever, but now we are focusing on the infectious diseases, emergency, and the government all be there. So it's well organized. As I said, we learned a lesson from what happened in 10 years ago for SARS. So the government, generally speaking, we will always have what's called national task force. There, usually it will be led by a vice premier. So you just, the office will be set in the Ministry of Health. So like whatever we have, the pandemic H1N1, this time we have the MERS, one imported case, from South Korea, and also last year we have Ebola. So always led by the government, and you have the vice premier, always a leader, so that make all the ministries, even including the Ministry of Finance, Ministry of Foreign Affairs and Health, but the Secretariat is located in the Ministry of Health. So the Ministry of Health usually organizes the meeting. So whenever what happened, this is exactly what happened when we decide to send people, to Sierra Leone. When we decide to do that, we thought we need two groups. One group for the diagnostics, because when we decided it's about August. At that time, try to identify the patient, identify the suspect. It's very important. This is why. So I'm a lab person. I'm the deputy head, but in charge of communicable diseases and lab management. So this is why, as a deputy head, I was there for the first team. And the second team is for the, running a holding center or holding and treatment center. So this is why, the first priority would be we need to build up a strong leadership led by the government. This is what David also mentioned. And secondly, we learned a lesson from SARS. You think about what we have done for the last 10 years. The local CDC, in China system, even in the township, township and countyship, prefectureship and province level. We always have different levels of CDC. So there, the capacity for the diagnosis and for the control. So all the facility always there. So building up the capacity, especially for the diagnostics, is very important. So this, the second priority, we should help. From my experience in Sierra Leone, I think if we don't help, I don't think they can do themselves. So they do need the help. We are talking about the incentives. We are talking about either private or the government donation. So they need this sort of donation to build up. So this is why I'm talking about post-Ebola. So we also learn that from China. Post-Ebola, we need to help them to build up their capacity for the test lab. This is why Chinese government decided to build up the BSL-3 lab in Sierra Leone. So now we have a BSL-3 lab in Sierra Leone. Hopefully, that will play a very important role, post-Ebola or in case we have another one. And thirdly, if you are there, you have a capacity, you have a leadership. And it's important we learn that you need to train the local CDC staff. So this is exactly what we have done in China. So training and education will be the third priority. So we should do. So me and Christine Brescia, we wrote something, but of course, just recently published in Nature, either World View or something, calling for the international collaboration or coordination to set up a training program, either in a MPH degree level or even in the PhD degree level, for long term, to help them to get really trained person there. And fourth priority, I would think, under some emergency situation, we need, I mentioned yesterday, the re-establishment of the trust or confidence to the undeveloped or less developed country from the developed country. So this is exactly why I give example. I was there, by the time we have a lot of goods and stuff sitting in the airport because they don't have the labor. No one helps them to distribute all this stuff. But the problem is if you ask them to do that, we were at least, at that time, so a lot of people worried about the corruption whatsoever, So this is why I think the fourth priority, we should build up our confidence or trust to the local. So that's very important, to whenever you have an emergency. For example, you might need to hire someone from the local, but you don't worry about this, something anyway. And priority 5, I would think, try to coordinate well to develop the vaccine and the therapeutics. So that's very important. And also we should try to avoid the problem we had this time. For example, as everybody knows, Fujifilm, they have a inhibitor for Ebola. It's called favipiravir. Favipiravir definitely will work, but the problem is at that time we cannot overtake the problem for the ethics. So we were discussing about how can we do the clinical trials for that Fujifilm inhibitor. So as far as I know, it's up to the end of last year, even early this year, we are still discussing how we can do these clinical trials. So we should find a way to, though we should encourage to develop some vaccines and drugs or inhibitors, we also need to overcome the strict ethics problem at the moment. We want to develop some inhibitors of vaccine, but we don't want the ethics to be the barrier for the development of the new drugs. So this is my 5 priorities I would give the list, and I think we can always discuss about this. Thank you.
That's great, thank you. Just to follow up on this, earlier in the session, we've often been touching on questions of aid coordination. There's one angle on this is that when you were engaging in the global pandemic surveillance and containment initiatives, as in Sierra Leone and West Africa, what was your experience in terms of collaborating with your own government's other agencies? So, for example, the bilateral aid agency, trade and industry agencies, and so on. How useful was that?
Yeah, I already touched a little bit from the very beginning for that kind of question. As I mentioned, because whenever we have an emergency, we will form a national task force. So this is very easy because it's coordinated by Vice Premier. So he can, at the moment, it's Madame Liu, and she can always get everybody together, all the ministers together, to have a emergency meeting. So this something really special. I mean, it's a special system in China. So in this case, you don't have any problem to coordinate with the Ministry of Finance and Health and Foreign Affairs because it's coordinated by the Vice Premier. And to try to link with industry. So it's important, under this, usually what we will do, for example, with this MERS, and we will have a, really open discussion to call in all those companies to really to get all their products, especially for some diagnostic kits, to get to be involved for the China CDC. So China CDC, we learn anyway from the US CDC. So we are doing the disease control and prevention. But whenever we have this, we always have a sort of open, I call it almost like a market. We call everybody here to show your product, what kind of product you have. So this is our collaboration and coordination with the industries. That usually works very well. And also, I want to mention to you a little bit about the MERS. When you are talking about the Ebola, don't forget, this time, a single imported case in China. We did very well. We did very well, so we identified, because we got the news from the WHO. So we traced back the patient, and we traced back all the close contacts. Everything settled down. So again, how did we do that? So it's a collaboration for the, public understanding of the public health. So that's very important, public understanding. Like I said, the training and education. Because all the ordinary people and in China, they work together with you. So whenever you say you are calling through the mobiles, through the, the videos and through the TV to say anybody who has a close contact with that guy, same bus or whatever, please report to the local CDC. So easily we got it, within 48 hours, we got all the close contact, more than 100 close contacts. Everybody we trace where they are. So this is how, we really get the MERS down. So that's the only imported case. Thank you.